I'd like to call this special meeting of the Buncombe County Commission to order on June 24th at 4 p.m. Let's begin our meeting with the Pledge of Allegiance. Let's please rise and join us in the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. We're going to begin our meeting with a closed session to consider several items. Could the staff update us on what the subject matter is of the closed session?
Mr. Chairman, Commissioners, it's a closed session to economic development under 143-318-11A4. Update on a couple matters there in direction from the board. And a third item under 143-318-11A6, a personnel matter, and just anticipate just direction from the board on that matter as well.
Okay, and is it one personnel matter or two different ones? I don't know if
I understood that it was one.
I believe there's two different personnel items that we're going to discuss. Okay.
Oh, okay. Okay.
All right, is there a motion to go into closed session?
Second.
All in favor, please say aye. Aye. Any opposed? All right, we're going to be in closed session. When we come back out, we're going to cover several items. Let me just review those real quickly. We're going to get an update on the GE road repair, the COVID-19 status, some announcements on NACo Awards, budget amendment for Methodist Home for Children, 911 MOU, child fatality report, and an update on the Stay Home, Stay Smart policy. So those are the items we'll cover when we come back out from closed session.
Good. Is the NACo best in class?
Maybe we'll get the local government federal credit union next month.
That's $1,000 when you win that.
$1,000 that'll go into a rightful fund, correct?
A rightful fund.
Well, affordable housing maybe?
Ooh. I think it can go to appreciation for employees.
That sounds pretty cool.
I think that's what Jennifer said.
What was it?
The other one we applied for, there's a cash award.
Really? I never heard of that before.
I haven't either.
That's interesting.
Well, I won one in Wilmington, so I'm assuming it's the same thing. And they sent $1,000 check. So,
Would you do pizza party for the?
yeah, sure did.
Really?
Sure did.
There we go, building the popularity.
Spent $1,000 for the department that won it.
Nice.
Yeah,
That's a lot of pizza.
well, it was pizza and then Christmas, and so it went for employee appreciation is when I accepted it and have that department head to choose how you wanted to spend it.
Can't go wrong there.
I wouldn't know what to do.
Yeah. Well, Jennifer can spend $1,000.
Oh, I know.
At the
Oh,
drop
yeah.
of a hat,
That's
maybe.
the job. Yeah. All right. Make sure the check is-
They're all gone.
So you don't have to do the,
It's two personnel things, and I've already talked to Sam about the economic development. So, very good.
oh, how long do you anticipate this to go in closed session?
Half an hour max.
Okay.
Sure.
All right.
Thanks.
Did we say anything we wasn't supposed to say? Good. All of y'all look the same. That's the only problem with the masks. Y'all got those masks up and we can't even tell how y'all looking back at us. Like, you like us, you not like us? All right, huh? No, it's true. Masks are like, everybody can't figure out their people's eyes.
You almost started enforcing it.
Those are so good.
Yep. Let's, Joe, we're just going to start.
Fine, go ahead.
All right. Good evening. We're going to, is there a motion to go back into open session?
Moved.
All in favor, please say aye.
Aye.
Aye. Any opposed? All right. The first item on our agenda is the GE Road Repair Project, and Tim Love and Mike Mace are going to help us out on this item.
Good afternoon. We have a short presentation that will walk us through. Go ahead and get started. Presentation is on the GE Aviation Road Repair. Sign says not to touch the mic, Max. We brought this to you in a briefing a few weeks back, and so just wanted, as we said in that meeting, we wanted to come back to you and sort of update you on where we are. So, overview and requested action. So, at our May 19th meeting, we first brought this to you at what we called it pre-meeting at that point, but which has since been changed to the briefing. So that update, since 2013, the access road has been in place, but it's been deteriorating. I showed you pictures of that and how quickly that it was occurring. Based on that, we sought sort of your guidance to proceed to get additional quotes, understand the cost, potential solution. And so we've done that, and so we want to update you on that today. In terms of a requested action, just up front with you, we're not asking for an action today. We're just giving you an update on where we are and what we think the next steps are. So the update is, so since that May 19th meeting, we worked with an engineer and the city of Asheville to design a long-term solution for that repair, and we'll show you what that is on the next slide. And at that point, I'll invite Mike Mace to come speak to the specifics of the solution. Our staff have solicited bids through an informal bidding process. We received 4 bids based on the solution that was designed by our engineer. One of those bids was non-compliant because it was received after the deadline. But of the 3 bids that were considered received and compliant, the range on that fix was $119,000 to $181,000 to implement the full solution. Per our general statutes, procurement guidelines, we would award to the lowest responsive bidder in this case, which would be at the $119,000. The final bullet, a key, is General Services has allocated funds for this in the current year budget. So we basically have it in the FY20 budget. We're not asking for it in the 21 budget, so no increase there. We already have the money, basically. In terms of the proposed design, Mike, if you sort of step up and kind of walk through, these are some schematics that we've received. You can see on the right kind of the outline of the project, and on the left, the specific solution.
Right, and on the left there, what's going to have to happen is a section of the road's going to be cut out. There'll be soil compacted back in through the road area. Also, the slope of the bank is where it's sliding down the hill will be recompact. There'll be a wire mesh, tensile strength, wire mesh screening that'll be put over that slope area, and then it also gets pegged somewhere around 7.5 feet, every 7.5 feet on center, with 20-foot-long pegs that will retain that wall. Of course, we then have to come back and repave that section and also install up the hill some more curb and guttering to prevent future runoff from affecting that area after we get it repaired.
And Mike, maybe if you could speak to some of the solutions that were considered. There was a question raised about a retaining wall and also some simpler solutions.
Yeah, so there was a question from the city of Asheville about installing a retaining wall. And in order to do that, we drilled core holes on site and ran into rock. So basically, if you did you'd have to put in a road, which would be very difficult to get down there to even start digging a footing for that area. So the wall would be somewhere around 30 feet. We're estimating $1 million project to put in a retaining wall for that area.
Thank you for that, Mike. And, I think the point there, and Mike can clarify, if you were starting from scratch and you didn't already have a bunch of facilities, a bunch of roads, a bunch of utility lines, maybe you'd do it differently. But given where we're at today, this is the solution that makes the most sense. Are there any questions about the design and, this wire mesh that we're talking about with the nails? If there are, I want to make sure that Mike gets to answer those.
I don't think so. It sounds like people got the information they need on that.
Good deal. Good deal. So, our next steps would be first to award the contract to the lowest responsive bidder, which in this case was at the $119,000 level. We would do that based on the way our procurement manual is set up. The county manager does have the ability to award that contract. Additionally, we would then try to mobilize to get the road repair going early July. And then, we'll continue to work with the city of Asheville to make sure that everyone's on the same page with how this road ends up in their system. So, are there any questions on that?
Don't think so.
Cool.
Thank you, Tim.
Thank y'all.
All right. Next item is COVID recognition, and Avril Pender will help us out on this one.
So, Commissioners, during the early days of the COVID-19 pandemic, the county, like other employers, closed some of our public-facing offices and allowed employees to work from home. However, due to our nature as public servants, employees were reassigned to provide staffing to the various needs for our COVID response. They worked on assisting the schools at feed-in sites, the security and management of the isolation and quarantine housing, hosting town halls, organizing testing sites, sourcing PPE, and the full gamut. We also, though, while we were doing our COVID response, had to do our mandated services. So register deeds, landfill operations, social services, employees continue doing their regular jobs. So over the last 12 weeks, employees have recorded over 80,000 hours. And some employees actually had an average of 24 additional hours, so 64 hours a week some employees were working. To recognize this effort, I'm requesting the authorization of up to 2 weeks of PTO, or personal time off, for the affected employees. To grant the leave, the board must hold a public hearing on that. So tonight, I'm asking if you would authorize a public hearing at your next meeting, the July 21st meeting, to discuss this in more detail.
Great. Do we need to formally vote on that, or if there is a consensus of the commission and no concerns expressed, we could,
Yeah, you can just set the date for the public hearing for the 21st.
okay. So without objection, are there any concerns about this from any commissioners? Okay, then we will take that up at our next, on that date. Great.
That would give staff the ability to advertise it for 10 days.
Excellent. Thank you for bringing this item forward. I think that, this has been to say it's been an unusual time in the county's history would be a big understatement. People have had to step up and do things that are well outside of what we think of as the traditional role of county government, because we're dealing with a very unusual situation. And while parts of our economy have kind of been put on ice, and a lot of folks have, not been able to work, other people have had to work harder and lift in heavier ways. So I think this is a great opportunity to recognize in the folks who have gone above and beyond during this tough time. So thanks for bringing this forward. All right, next up is are the NACo Awards, and Vivian Sevilla will present this item.
Good evening. My name is Vivian Sevilla. I'm with Performance Management. Back in March and April, our department, Performance Management, partnered with various departments to provide them information about recognition opportunities. And we submitted 3 applications for the National Association of Counties organization, and all 3 were accepted and recognized. So those departments are planning, soil and water, and soil and water, planning,
Sustainability.
and sustainability for the Energy Innovation Task Force. Thank you. Max put together a video for us to watch tonight that highlights the recipients and those awards.
Great.
Performance management supports all county departments and has the unique opportunity to see the innovative ways county staff are approaching their work. In an effort to bring recognition to these programs and staff, we had the idea to encourage departments to apply for awards from some of the leading nationwide local government support organizations. While departments might have applied for these individually in the past, having a centralized and coordinated approach to seeking out these awards allows us to highlight how Buncombe is leading the way as a forward-thinking, innovative county government.
One of these nationwide local government support organizations is the National Association of Counties, also known as NACo, and it connects local municipalities together to advance excellence in public service, to not only help the counties, but also the communities within these counties thrive. They value collective knowledge between governments, teamwork, and lifelong skills development for all their organizations as members. Every year, they host an award ceremony nationwide to honor local government achievements in multiple categories. Buncombe County is proud to announce that it is the recipient of 3 such awards due to their innovative programs and methodology.
Our planning department received an award in the planning category for its community-oriented development program for affordable housing. Due to its exceptional results and unique innovations, this program was also chosen to receive the honor of Best in Category. Only 1 program per category is selected for this distinction.
We're honored and excited to receive the NACo Award for our community-oriented development project for many reasons. 1, we're proud because we came up with the project here in Buncombe County. 2, it helps provide more affordable housing by providing incentives to developers to include affordable housing in their planning. And 3, that so far, we feel it's been pretty successful. The program recognizes the challenges we face locally with our high property values, limited spaces to build, and the fact that we're just a popular area. The program also seeks to focus on projects along transportation corridors and within close proximity to grocery stores and other important community resources. Planning staff is thrilled to continue our progress for this program and are excited about the impact we're beginning to see with our efforts.
Our partnership in the Energy Innovation Task Force also won in the County Resiliency, Infrastructure, Energy, and Sustainability category for its tireless efforts to implement strategies to prevent the building of a peak energy plant locally.
The EITF was created as a collaboration between Buncombe County, the City of Asheville, and Duke Energy. It really was a direct response to Duke Energy's plans to build a new gas-powered peaking unit at the Lake Julien site. This was going to be a $100 million plus facility that really only got used a few times a year, and of course that cost ends up going back to the ratepayers. So the EITF's goal was to either delay or avoid the need for that new fossil fuel infrastructure. So the EITF engaged in a multi-year campaign to determine the demand reduction needed and to enhance and create programs to address energy efficiency and demand-side management. So the EITF's partners were successful in increasing market penetration for existing programs, for reducing energy burden for low-income households through energy efficiency and weatherization, and really creating a branded and coordinated public awareness campaign around this issue. And as a result, through this collaboration and community engagement, we were able to avoid the need for this new fossil fuel infrastructure, which was just a huge win for our community.
Finally, our Soil and Water Conservation District won in the Arts, Culture, and Historic Preservation category for its Farm Heritage Trail. This is a stretch of trails throughout the county to encourage the protection of farmland, local food, agritourism, and more.
The Farm Heritage Trail is a scenic driving route through agricultural communities of Alexander, Leicester, Newfound, and Sandy Mush in northwest Buncombe County. The public is welcome to travel the public roads of this trail and enjoy viewing the conserved family farms with designated signage that are along the route. The entire route is a leisurely 2-hour drive while enjoying farm stops along the way. Trail riders may choose to follow the specific route or enter and exit at any point, selecting events or regions that they may want to drive by or visit. The Farm Heritage Trail recognizes the importance of protecting farmland, honoring agricultural heritage, and supporting the future of agricultural operations in Buncombe County. The outcome of this project is a stronger agritourism community within the county, a network of farmers for the public to connect to, and increased awareness of the experiences offered on the farms in Buncombe County. This award shows how Buncombe County's farmland preservation efforts stand out nationally, and that the Farm Heritage Trail is a prime example of the innovativeness and resourcefulness of the county.
Great. Vivian, thank you so much for sharing this information with us. And let's give a round of applause to all the people for the great work in this area.
Commissioner, before you move to the next one, we do have a new department head with us that started back in March, but because of COVID, she was never introduced. So I do want to ask Jennifer Harrison to stand. This is the department head, soil and water, and it got combined, so it's ag and lang now. So I just wanted to make sure you met Jennifer.
Great to meet you, Jennifer. Welcome. We're so glad to have you on the team with Buncombe County. All right. The next item is the budget amendment for the Methodist Home for Children, and Jennifer Barnett will present this item.
Good evening.
Good evening.
The budget amendment we bring before you this evening is for a request of a one-time increase to the grant of Methodist Home, so the Methodist Home Grant. If you will recall, the Buncombe County is the fiscal agent, so essentially we receive this funding as a pass-through on behalf of the state to the Methodist Home. The request is for $14,819 additional dollars in the budget. The state is providing to the Methodist Home this one-time additional increase to pay essentially hazard pay, so dollars to be able to put towards salary of their staff. So we just need a budget amendment to be able to pass that back through to the Methodist Home.
Okay. So we don't, well, this is not a pre-meeting. This is a special meeting, so we can absolutely vote on this. All right. Is there a motion to approve?
So moved.
Second.
Further discussion? All in favor, please say aye.
Aye.
Thank you, Jennifer.
Thank you.
All right. Next up is the 911 Memorandum of Understanding. And Brooke Hazlitt will help us out with this one.
Good evening.
Good evening.
I'm here to introduce an interlocal agreement between Buncombe and Henderson County. The agreement is for the backup services of our 911 lines. Henderson County, for about a decade, has been who answers our 911 lines if they were to go down within Buncombe County, but that agreement has never been formalized. And we were advised by the North Carolina State 911 Board last year that it does need to be formalized in order for us to update our backup plan with the state. So we are just asking to approve that agreement and approve signature of that agreement.
Are there any questions, commissioners? Is there a motion to approve the resolution for the interlocal agreement?
So move.
All in favor, please say aye.
Aye.
Any opposed? All right, thank you so much.
Thank you.
All right, the next item is going to be presented by Dr. Jennifer Mullendor, and this is the Child Fatality Report.
Good evening.
Good evening.
So tonight in this section, I'm going to be covering key points from our 2019 annual report to the board that I submit as chair of the Buncombe County Child Fatality Prevention Team and the Community Child Protection Team. And so just a very brief overview of the system. So the purpose of the North Carolina Child Fatality Prevention System is basically to assess the records of deaths of all children who live in the state dying before the age of 18, as well as certain cases of children who are being served by Child Protective Services in order to understand and develop a community-wide approach to addressing child abuse and neglect, to understand what is causing these childhood deaths, and to identify gaps and deficiencies in the systems to hopefully make and implement recommendations to prevent future child death, neglect, and abuse. And every county in North Carolina has two teams that are part of this system. The first is the Community Child Protection Team, and that team reviews selected active cases of children who are actively being served by Child Protective Services, and all cases in which a child died as a result of suspected abuse and neglect and was either a recipient of Child Protective Services within the prior 12 months or there had been a report of abuse or neglect about the child or family within the prior 12 months. And so last year we reviewed 2 open DSS cases and some of the findings that came out include things that aren't uncommon for prior reviews in other years: substance use disorders, mental health disorders, intimate partner violence, and generational abuse and trauma are frequently involved in these cases. And some specific needs that were identified during those reviews included the need in our community and our region really for additional substance use detox programs for individuals with medical needs. And then also additional program slots for mothers who want to go into residential substance use disorder treatment that allows them to bring their children with them. So these are things that our community has been talking about as a need for quite a while. The other team that is active in every county is the Child Fatality Prevention Team. And this is the team that reviews the records of all cases of child fatalities that don't have to do with families involved with the Child Protective Services. And it's important to know that we review fatalities the year following. So in 2019, we reviewed 2018 deaths. And so this year in 2020, we're reviewing 2019 deaths. And there's some data I'll share in a couple slides about what were the causes of those deaths. And in most counties, including our county, these teams are combined into one team. And so your job, your role as Board of Commissioners, is to get an annual report from the team and to advocate for system improvements or resources if indicated, and then when necessary, appoint members to the team as part of, as delegated by the state statute. And we don't have any members that need to be appointed this time. We have a full, robust team. And so this is some data. This is the data for those child fatality reviews that we conducted last year that shows the breakdown by cause of death. And so last year we reviewed the deaths of 20 children who resided in Buncombe County at the time of their deaths in 2018. And just to explain an acronym there, so SUID, S-U-I-D, stands for Sudden Undetermined Infant Death. And so that could be things like deaths due to suffocation, or it often, in this case, these are unknown cause. That's often where children who may die, who maybe had unsafe sleep environments, fall into. And then details about the accidents. One was a accidental, what seems to be an accidental gunshot wound, and the other was a drowning. And then when we look further into fatalities by age, again, infant mortality, it's a high-risk time for children to die, and so we can see that half of the 20 deaths we had did occur in children under the age of 1, which it makes infant mortality. And when we look at specifically the causes of those infants dying, we see that prematurity and perinatal conditions were the most common. And so perinatal conditions could be things like maybe something happened during the delivery that led to a condition that led to the child's death, whereas prematurity is, being born before really 37 weeks of gestation. And again, as I mentioned, those sudden and unexplained infant deaths, both of those were related to unsafe sleep environments. And that's something we've talked about before in this county, and have made efforts about. Both last year and the year prior, our team gets money from the state, and we can do with it what we want that's relevant or that's related to preventing child deaths. And so both this year, in this fiscal year and last fiscal year, we used that money to purchase pack and plays. Last year, we gave them to several of the homeless shelters in town who needed a place for babies to sleep when their families were staying there. And so we've also used the funding to support some of the campaigns that we've done. What I'll say about 2018, if you can say there's ever any good news about infant deaths, we didn't have any black babies die in 2018, which is, again, we know that we have a great inequity between infant mortality when we look at blacks and whites in our county. And so that was a good thing to see in 2018. And we'll see how that affects our infant mortality rate going forward. If you have any questions about this data, I can certainly answer more. But one of the things that came out of our reviews last year, if I go back for a second, you can see that we had 3 children die from homicide in 2018. And so we spent a lot of time last year really talking about gun violence and intimate partner violence in our county and the impact that has on families and children. And so, the team comes up with systems, they identify systems problems, we make recommendations and take action. And so one of the recommendations that came out of that discussion about gun violence is something I included in your packet that, we really struggled with how to, as a team, what recommendations we should make around gun violence. And so what we ended up coming up with was asking for our the law enforcement chiefs and the municipalities, managers of municipalities in the county, governmental officials to lead or promote community work related to gun violence, pulling together representatives from all sectors, from the affected communities, to work on trying to understand and addressing the causes of gun violence in our community. And so that was a recommendation that I'm making here tonight, and I'll be taking to the Justice Resource Advisory Council in July. So I'm available to answer any questions, should there be any.
I don't have a question. I just want to say thank you. I had the opportunity to be part of this group the first couple of years I was on county commission, and it's just a tremendous group of people. It's often sad work and it's hard work, but I think you all have worked so hard on pulling the data and being able to kind of talk about this with this degree of specificity. So just want to express appreciation for that, and please relay to everyone on that committee how much we appreciate the work they do.
So I just have a question on the relationship to the newborns and drug use and how we track that and how we see if we're getting better. Are we able to help those mothers, through the childbirth? Are we able to work through that? I'd just like to hear, more information, more discussion, measurement on that so that we can know if we need to, put more time or resources, into that area. I don't know if, on the younger results of the, the fact that there was an absence of, thank the Lord, there was absence of, black children that had died. Sometimes the drug use is more related to the rural white, mothers and so I'd just like to hear maybe more about the measurement of that. Not necessarily right now, but I thank you for this is tough work, but I'd like to see how that is going in the future. So.
I can speak to it now. I will say
You
from
can
the
go
in
at it.
2018.
I just don't want to put you on the spot.
Actually, so in my review of the 2018 data when I was writing this report, that was not a big factor in the 2018 deaths at all. And I would say that, there's a lot of good work in this community, which I think you've heard about, right?
Oh,
You've
yeah,
heard about the START team, you've heard
all
about
about it.
Project
Yes,
Kara.
ma'am.
So I think there's a lot of good work, not trying to criminalize behavior, but to help people engage in treatment and have success as a family.
Yeah.
So,
Okay,
yeah,
thanks.
so again, some more good news
Thank you.
out of 2018. Anything else?
All right, any other questions, commissioners? All right, Dr. Mullendorf, thank you so much for the update. Do we need to vote to accept the report, or have we accepted it by the fact that we've had this discussion and reviewed it? Okay, all right. Just making sure. All right, and the last item on our agenda is a discussion of the COVID-19 situation and stay home, stay smart policies, and Dr. Mullendorf and Fletcher Tove will give us some updates here as well.
All right, so we'll start out just looking at the data again right now. So this is our dashboard as of this afternoon with the trends on it. So at that time, at 12:16 p.m., we were at 513 cases, 37 deaths. So, our case count continues to rise. Thankfully, it's not exponentially rising. It's a slow, steady increase. I would say our contact tracing, we have 13 contact tracers from the state. We've requested more because the staff are maxed with their assignments, but we're hanging steady and doing good work in that. In terms of the testing, testing continues to increase. We have more clinics coming online, offering some testing. We've had good success with our community testing sites, and we're getting ready to get back out starting next Tuesday with some more permanent community testing sites. And so basically for the next 10 weeks, we're going to have testing on Tuesdays, Thursdays, and Sundays now. And so Tuesday the 30th, we'll be out in Swannanoa at the Ingalls parking lot out there. That'll be, we'll have, in the Tuesdays and Thursday time periods, we're going to allocate or designate the first hour, so from 9:30 to 10:30, for staff who work in long-term care facilities or congregate care facilities. And so those would be for especially like maybe the family care homes who have smaller number of residents, smaller number of staff. And so sort of designating a time period where they can send their staff. Then it would be open to the broader community from 10:30 until 1:30 p.m. Thursday, we'll be back at the Buncombe County Sports Park. That was a really successful site for us. And again, that will start on July 2nd, and that would be from 9:30 to 10:30 for the long-term care facility staff, and then general public from 10:30 until 1:30. And then on Sunday, and that will begin on July 5th, back at AB Tech. Again, another really successful site, easily accessible to people. And that will go from 1:30 p.m. until 5:30. And so we're going to, again, trying to vary some hours, vary some days, hoping that it will become more accessible to people who work different hours. And it's also, these sites are close in proximity to bus lines. So they're predominantly for drive-through testing, but we will, of course, accommodate walk-up traffic. So again, we expect testing to pick back up this week. Western North Carolina Community Health Services has been focused on senior living, like low-income senior housing areas, and so that's been going really well as well. In terms of syndromic surveillance, that's the...
Can I ask a question, Dr. Moore?
Certainly.
And
certainly.
so at those facilities, there's no upfront cost to get a test.
At the testing sites?
The testing
Correct.
sites. It's,
Correct.
no upfront cost. If someone does have insurance, we ask them to bring their insurance information. But if they don't have insurance, they just come in and they'll get tested.
Right.
So is that correct?
That is correct. We bill insurance, and there should be no co-pays associated with the testing from their insurance if they have insurance. But yeah, no out-of-pocket costs.
Great. And can I ask one other question, just based on
Yeah.
our experience with these being done? About how many people, if there's the demand for it, about how many tests can we run in an hour at one of these facilities?
Well, I mean, if you look at so the last two that we did 150, and that was in 3 hours. So, and I think oftentimes they're really busy at the beginning, right? Everybody's ready to go and wants to be there first. And so we probably do a bigger volume right at the beginning, and then there's some space. So,
okay, thank you.
Yeah.
Great.
So syndromic surveillance, that means, are people with COVID-like illness showing up in the emergency department, and to what degree? And that, in our region, that number, or that rate has decreased a little bit. Not the case for the state as a whole, but in our region, that has decreased some. And then the percent positivity, we're going to hopefully update our dashboard Friday at the earliest, which will show our percent positivity trends. But when I looked at it, the mock-up today, it looks like that's on a decline, which is good. That's where we want it to go. So these are all good things.
That's awesome.
And then our healthcare burden, we know, like, there's been, we've heard for the past couple of weeks from Mission that they are seeing more people in the hospital with COVID, but capacity still seems fine, but we're just watching that closely because we know, again, across the state, that's something that's happening. We're seeing more hospitalizations.
Can I ask a quick question on that? If we think about a scenario, where, let's say there were to be a surge in the state, we certainly hope that's not the case, and certain regions maxed out their capacity, is there sort of an overflow scenario where Western North Carolina might absorb some of that, or is that not how it works?
Oh, Taylor, do you know if that would happen? I'm not real sure. I don't.
And it's okay if
Yeah.
we don't know the answer.
Other states have done that. I can't speak to it.
Yeah, I haven't heard conversation about that at this point.
Okay, thanks.
All right, so I think I'd turn it over to you now, Fletch, right?
Couple things on
yeah.
couple things on the dashboard, and I don't know if we, ought to have these numbers up there, but of the 513, how many have recovered?
So,
Okay, and the other question would be when we talk about the number that's in the hospital. I mean, I have people ask me that, and they want to know, well, Joe, how many people are in the hospital? I mean, is it 3? Is it 300? And so we need to be able to access that information.
So that's one of the number recovered. So I explained this last week to the media. So we don't use that term, and the reason for that is when we have an active case, we follow them, and then we release them from isolation based on CDC guidance, and that has to do with, are they 10 days from the onset of their symptoms, and has it been also at least 3 days since their symptoms have improved or their fever has gone away. So we release them from isolation. The problem is, it is possible that those people might get sicker, right, and might end up in the hospital. Even though we've released them from isolation because they're no longer contagious, they aren't necessarily recovered. There's no definition of recovered, and we know that some people have sequelae, like have long-term complications from COVID. And so what we're going to show on the dashboard is the number who are active cases, basically those who are in isolation. And so you can do the math then to say we have X number of cases, we have X number of deaths, we have X number of people who are active cases in isolation, and that would tell you who's been released from isolation. But again,
So-
I wouldn't use the word recovered.
So released from isolation is okay.
Yes.
I mean,
But
that,
it could, I mean, we can't say that they're recovered because they could have long-term.
and say they're released from isolation, then at least people can see that positive information, which they're seeking, and we're not trying to keep it from them, but it'd be better to show, in my opinion, it would be better to show that than to have them do the math. You see
So
what I'm saying?
both like the number active cases in isolation and then also
Yeah.
the
I
math
mean, if you
of
got
that.
513, which I think was
Yeah.
the number, and we know that there's whatever the number is, it's released from isolation, then people are going to.
Okay.
And then you have the last number is the active cases, and then you have the number that are hospitalized. And I mean that's pretty
Right.
clear for people.
And I'll talk to the business intelligence folks who are working on the dashboard,
Right.
MC, about that. Now, the number hospitalized is something that, our, Mission isn't the only hospital in the county.
Oh, sure.
And that we could have Buncombe County residents hospitalized outside of Buncombe County, right, if they were traveling. We should know about all those cases. If they're Buncombe County residents, they should be reported to us. And it's just a conversation I've had with our HIPAA compliance officer about what we are able to release as a covered entity. State isn't a covered entity, and so they can be more, share more data.
Yeah.
And so I'm working on that conversation to see, can we share that information if it comes through the communicable disease nurses, or is that data we can get from the hospitals themselves and share it? And so it sounds like it shouldn't be this hard, but we just have to watch. We have to watch our like what we're allowed to share, what we're not.
And I appreciate all those
Yeah, we're
considerations.
working on it.
I hope that there is a way we can, because it does seem like such an important number, right? Because for
Yeah.
all of the the terrific work to expand testing and get more data, and we're learning more and more. We know so much more now than we did 30 or 60 or 90 days ago. We also know all those systems are imperfect, right? Because we're it's still just sampling of the population and things like that, and the tests are not 100% reliable. It's just it's great, but it's not perfect. So in some ways, kind of like how many people in the community are getting sick enough that they need to go to the hospital is that's something that is an important thing
Right.
for us as a community to try to be aware of, consistent with all those considerations that you identified. So if there is a way to do it, because I know just looking at the looking at those numbers statewide, it does kind of cause you to kind of sit back and say, okay, we've been at this for a while, but wow, we probably no other statistic reminds me that like this is still very serious. There's 50% more people who are so sick that they needed to go to the hospital,
Right.
many of whom need help breathing, 50% more than 30 days ago, right? And that number's going up. And it's more in Buncombe County than it was 30 days ago too.
Mm-hmm.
Fortunately, we're still at a lower rate than most communities across the state, but it has grown. And so to the extent we can protect all of that confidentiality, I hope we can, and hopefully we see those numbers start going back down.
And there's been talk too about creating a more regional dashboard as well, because again, Western North Carolina, it's not the same as the rest. And so there are conversations on multiple levels about what to put on the county dashboard and what could be also a bigger picture of what's going on in our region. So
And
I
I
will
think
follow up on that.
And I think the reason we push for this information is that, we're trying to balance, we're trying to balance people being fearful and people being concerned. And we want people to know that there's still a real possibility that you could go to the hospital, if you're in any age group and it's ticked up a little bit. But we need to be able to people, if they have really good information, they're really able to process it, and make good decisions. And I think especially in Buncombe County. But.
Okay.
Of
Thank
the
you.
37 deaths, how many were in nursing homes?
I think we are now at 32.
Okay.
Yeah.
Could you say again the current hospitalization data, if we have that?
So all I have is what I get from Mission.
Right,
And so I think, again, for the last couple of weeks, they've been in the high teens.
Yeah, and that's where they still are.
Yeah,
Okay.
I feel like.
Dr. Mulder, can I ask a testing question, please?
You may.
So someone shows up at one of the community testing sites, and are we just testing symptomatic, or are we just going to test? And if someone shows up without any symptoms and they have insurance, can we take the insurance and they would be tested, or is there something else that says no?
No, so yeah, because the criteria opens up so much broader over the past couple of weeks, we're testing, clearly symptomatic individuals, people who say they were close contacts, regardless of whether they have symptoms, and then people who are in all those high-risk groups. And so the testing site isn't really screening those people to say, so it's like if you show up, you're going to get tested. If you have insurance, they'll bill your insurance. If for some reason your insurance says they're not going to cover it, then that will be taken care of and you shouldn't have to pay for the test. So it'll be handled, yeah.
So I got one other question regarding nursing homes.
Yes.
So we've put the word out, I assume, to the nursing homes that, hey, we're going to have 9:30 to 10:30. And I guess, right.
Yeah, so we talked about this. These decisions were made this week. And what we're talking about so the nursing homes and the adult care homes, so the bigger facilities, those are the facilities that the proposal you all approved last week. That's for them, because with large numbers of staff, it's better to go into that facility.
There, right.
What this testing is really for is maybe a staff member was unable to get to the testing that day at their facility, or for those smaller facilities who don't have hundreds of staff, they could send their staff to these testing. So like family care homes who, by statute or by regulation can't have more than 6 residents in a home are going to have smaller numbers of staff then.
Great.
So that's kind of what this is geared for.
Okay, great, thanks.
Yeah. All right, then I'll turn it over to Fletch.
Good evening, everyone.
Good evening.
So, as you're probably well aware, Governor Cooper issued Executive Order number 147 this afternoon. Commissioner Belcher, a couple months ago, you said you thought we went a little overboard with our whereas clauses. And I'll tell you, this new order has 5 pages of whereas statements.
Nice.
Yeah. So I'm going to give an overview of what we see with the new executive order, what that means for Buncombe County, and have a couple points of discussion. So basically, this is a 3-week pause on our reopening, phased reopening. So we're staying in phase 2 guidance, which we reverting back to executive order number 141, which we were currently in. Will stand, and that goes forward and be reviewed, set to expire on July 17th. Other than that, really the only change with the new executive order is that starting Friday, there's now a statewide face covering mandate, and we'll go into some details on that momentarily. So points of discussion for us today. We talked to you at the last meeting about making recommendations going forward for our existing lodging restrictions, and we'll look at some data for that, and we'll discuss the face coverings. So Tim Love was able to pull some great data, which I'll turn over to him from Explore Asheville.
At the last meeting, there were a number of questions about occupancy rates, staffing, things of that nature. So we went and reached out to get some data to bring to this discussion. But just as a reminder, kind of where we're at today versus where the state is. So, at the North Carolina governor's level, no capacity limits on lodging, no turnover requirements. In other words, the 24-hour sort of turnover between stay, but increased sanitation requirements. At the county level, we've imposed a 50% capacity limit, which does not apply to units that have, institutions that have less than 10 units, so like a bed and breakfast or something of that nature. We have imposed a 24-hour turnover requirement, and we have increased sanitation requirements. So that's kind of the state of play. I know you know that, but I just wanted to reiterate it. So we reached out to Explore Asheville or the TDA, but additionally, we also reached out to the Bed and Breakfast Association, the Homestay Network, and the Hotel Association. So we've got 4 industry groups that we reached out to and asked them pretty basic questions like, how does this impact jobs, revenues, and bookings, the capacity limit? How does that impact? how does the turnover limit impact your jobs, your revenue, your bookings? And they gave us some answers, and I'm glad to talk through that at any point. But with that said, on the left side, we've got occupancy kind of information. On the right side, we've got staffing levels. So occupancy-wise, for May, you can see we've got 2020 data versus 2019 data to give you kind of a year over year. In May, we were at 22% occupancy, whereas we were at 77% the prior year. So that's one data point, just giving you an idea. In June, we're at 40%, and there's an asterisk there just because we're not complete with the month of June, obviously, versus 83% in the prior year. A caveat here, when we talk about occupancy across Buncombe County, it varies greatly. Weekdays are different than weekends. Part of town is completely different too. Clearly downtown Asheville, demand is going to be higher on a weekend than in other places. So on the topic of demand, because that was a question raised, do people even want to come here at this point? It's a pandemic, let's be honest. And so the question is, it varies. And Explore Asheville has data on this, by day of week, by part of town. But as you would guess, weekends are more popular. And so we're seeing folks, some hotels, not all hotels, reaching that 50% capacity limit on weekends. And some would say that they would be able to exceed it if the capacity limit was lifted. Third bullet, competing markets are doing pretty well. We know that we're one of the few imposing any restrictions, but those around us are not, and we know that they're booking and selling out effectively. In terms of staffing, so this is kind of where the rubber meets the road. Pre-pandemic, if we're at 100% staffing, that's about 4,800 or 4,800 employees, so 5,000 employees, keep it simple. Current in Buncombe County with the restrictions in place, again, that's the capacity plus the turnover limit, we're at about 30%. This isn't exact, but just to give you an idea. So that's out of the 5,000 employees, that's about 1,500 that are currently working. Anecdotally, we asked the industry, what happens if the limits come off, the restrictions? What would happen then? Do you go back to 100%? What happens? And they're saying maybe 80%, which brings back, gets us from 1,500 employees to almost 4,000. So there is an increase there. Be honest with you, it's not going to happen overnight. And I think for many reasons, one of the big ones is, there's still lots of concerns with employees and travelers and their sentiments. Is it safe to travel? Is it safe for me to go to work? Is it in my best interest to go to work? Those are real questions, and we shouldn't pretend they don't exist. The biggest thing that I would pass along from the industry, though, is in terms of their ability to hire, some type of notice is what they're seeking in terms of lifting restrictions. You can't just say today restrictions are off on Friday and expect hotels to be booked. Most travelers, I'm told, are looking 6 weeks in advance, which kind of makes sense when I plan my travel. But the employers are asking for about 10 days so that they can ramp up, get people back to work so that they can absorb travelers. So that's some quick information on occupancy and staffing. This is not an exact science, but wanted to give you something to think about. Also glad to share any specific insight from the different associations, bed and breakfast versus homestays, et cetera, if that'd be helpful. But if not, I'll turn it back to Fletch, unless you have questions.
I do have a question. Did they give you any indication if we went and adopted the state guidelines, which allowed them to go ahead and book, on the anticipated job increases back to 3840? Did they give you any indication how, quickly they could bring those people back?
Very significantly. One large hotel said, you do it, we'll flip the switch, basically, which surprised me. Other smaller groups, I don't think they could do that, but it's going to be incremental either way. Just to be very practical about this, we're all aware of the unemployment insurance benefits, and that is an impact. For some, that option is better, staying safe, staying at home, than going back to work. So I think that'll be prohibitive as well.
In terms of some employees might choose not to go back to work even if it's available right now if they can continue to
That's a common sentiment, not just for this industry.
We hear it from many people. I mean, a lot of, there's a lot of jobs in our community that don't pay a lot, so that has been a kind of rational financial decision that some people have been making, and some would continue to make it, although that's not going to be there, indefinitely, right?
Yeah,
So,
Correct.
Right.
yeah.
But Commissioner Belcher, to your point, I think some of our large entities would move very quickly.
Yeah.
Others may move more slowly.
Because, what I have been hearing, not just from, people that have the hotels, but the people that work there, is that a lot of them are ready to they're ready to go back to work. Some of them will probably choose to wait if they're getting benefits, but, I believe a large number will go back to work. If all of them went back to work, I just did some quick math, if they made $30 a year, as $72 million in pay if they get to 80%. So it's a lot.
And Tim, these numbers are just for the hotel sector, not kind of related tourism.
Yeah.
Correct.
Right? It's just for the hotel sector, right? I just want to make sure we're thinking about the numbers in the right way.
Yep.
Okay.
And this is limited to hotels, which we have really good data sources for. But Airbnbs, homestays, that's much more difficult to capture. But this does not include restaurants or anything like that.
I mean, I look at that number, and I was actually taken back, when I saw that. 4,800, and the current with the restrictions is 1,440. That's a big impact.
Yep. And I'll reiterate, of course, these are estimated numbers. I don't
That's
have
fine.
Sure.
a pulse on it.
All right, Tim, thank you so much. Great data for us to appreciate you organizing this.
So from our previous order, if you can recall, there are two exceptions where we were more restrictive than the state for lodging. One was with a 50% capacity. The other was requiring a 24-hour turnover between turn-in rooms. So when we look at this data, we look at the effects of that, we can recommend relaxing both of those restrictions going forward. We think, in part, the market is going, and people's natural concern with the pandemic is going to regulate their capacity. Commissioner Whiteside, you mentioned last meeting that a lot of them need about 60 to 70% to stay viable.
Right.
Doing this in isolation, Buncombe County alone would have, we're not necessarily seeing the full effect of what we want from those restrictions, knowing that from the data, cell phone data and other data from Explore Asheville, that people are just coming to neighboring counties and coming in for the day.
All right, thank you, Fletcher. So the governor announced this afternoon that he's basically going to pause moving into further commercial reopenings, but creates a mask requirement, and that goes into effect. The governor's new order goes into effect on Friday.
Correct, for 3 weeks. And I have some slides here just to,
Sure.
That's the discussion on lodging restrictions. Here, just so for the use of face coverings statewide, he points out several sectors and gives specific guidance, but in general, indoor and outdoor, when you're within 6 feet of other people, mandated. There's lots of exemptions. There's a clause here you can see on the screen, specific exceptions. This is certain activities or medical reasons somebody may be accepted from these rules. It does specify that if anybody declines to wear one, they should not be required to produce documentation or medical documents or any kind of proof of their condition. But there is some applications of this exception. There is an interesting clause that says North Carolinians as a whole are on the honor system, and that asking everyone to tell the truth about whether they're healthy and they can wear these to protect the public health, and also about how businesses may accommodate exceptions. So I think it's important to clarify that if a customer does have an exemption, that the business can choose the terms of the service delivery. So the business doesn't mean they get business as usual. They can determine how they would adapt to that, whether they want to do the curbside service for that particular client or have different routing or different service delivery. So there shouldn't be the exception that because people have a medical exemption or others, doesn't necessarily mean you get normal service. You still get service. The business gets to choose how they adapt to that situation.
Yeah, and the restaurants are doing that now. I mean, if you go out to the restaurants, you may have They may let you dine in, they may not. I mean, I'm thinking of 3 different ones that I've went to in the last week, and they're all different in how they were all safe, or I wouldn't eat there, but they all were. But they basically, as you said, the service provider made that decision.
Right. And then finally, just to cover the enforcement, similar in spirit to what we did locally, no citations, no enforcement from law enforcement to the individual. They could come in if somebody refuses to comply and gets to the bounds of trespassing or aggravated assault, they can intervene. But there is a site that they are saying that they can cite the business or organization that fails to enforce these requirements. So we may not see individuals being cited or fined, but from the order, they be written only to businesses or organizations that fail to enforce the requirement to wear face coverings.
All right. Is that the last one, Fletch?
Yes. And then, just where we're going with this, we had been working in parallel, planning a renewed campaign for public awareness for masks with the governor's direction today. We saw that statewide. So looking for some input here. This is just one of many graphics we're working with Stacy Wood and Joint Information Center. Even though the EOC is in reduced operations, they're full steam every day. Working with the city of Asheville, working with other local groups to push out more signage. As we have these town halls, one thing we consistently hear from local businesses is they want more signage about masks. They want stronger language in that signage, so it's not just a grassroots sentiment thing. It's very clear that it's a mandate, that it's orders. So we're working different things. But this is one thing coming to you guys for some input. These are very similar. The only difference is you must wear a face covering in North Carolina, or you must wear a face covering in Buncombe County.
I'll jump out there real quick. The one that hit me that I felt was not. I like the North Carolina one better. I think it provides the accurate information that it is a requirement in North Carolina. So that way, if people have a concern in regarding Buncombe County, the county's in the state. So it's required by the state.
Right. I think that's a good point, since we're also citing the governor's executive order. The sentiment thinking Buncombe County, it did kind of make it local. So just looking for some input from the board, but I think that's a very good point.
You might, it's kind of the business that's going to be putting it up, right? So you might make them both, and some businesses might prefer to make it local. Others might kind of, like as Commissioner Belcher saying, it might kind of resonate with them to say, hey, this is a state policy. So I don't know. I think they both, I'd kind of have both available perhaps, and let the businesses decide which message they feel like works best for them.
Okay. And there'll be, yeah.
I'd like them both. Also, I wonder if there might be some additional messaging that kind of draws the connection between wearing masks and us being able to keep our economy open. I think for some people this is very motivating. I think for other people this is not as motivating. And the more that we can link our capacity to have an open economy with people doing the 3 Ws, but especially the mask piece, I think elevating that might be important as we move forward as well.
Yes, ma'am. And this is just one of many graphics we're pushing out. We're also looking at billboards and other places for signs. One of the other ones kind of draws parallels between if one person wears a mask and one doesn't, whether they're transmitting or receiving, and then if both people are in masks, the scientific percentages of how much that reduces the likelihood of transmission. But we're also looking at the impact, on the local economy as well. Mm-hmm. And that's the last of my presentation.
So I have a
Commissioner
question.
White, did you have
I'm sorry.
It's okay. Did you have a comment? Okay.
So, Fletch, I have a question regarding churches. I know they come under the 141. Is that right? So
yes, sir. Since we refer to 141, there's an exemption clause for religious institutions and religious and worship ceremonies.
So my question is, I have received several requests for, we understand that, but we would like some things that we could post, or we would like to be able to give our congregation some guidance. And I'm wondering, as a resource, you know, could we look at that? Could we research that? Could we maybe have, because all they'll do is go and click on a PDF and print it, you know, and then they can put it outside the bathroom or in their lobby or their common areas in a church. So I don't know if you might be able to help with that or help us connect them to a site, because I am getting that question quite often.
The question about whether this applies to the.
No, that they would like signage for their church or for their
Yes, sir,
congregation.
absolutely. We can. I'll get you links to resources, and if we need to develop new ones through the JIC, we can also make that a project as well.
Yeah, and I think if they saw some of that, I think that it would be very helpful to them. So thank you.
Yes, sir.
Mr. Chairman?
Yes, sir.
I want to ask a question. I know that the governor said that the business could be cited.
Mhm.
What I want to make sure we clarify is who does people need to call? I've received probably 5 or 6 phone calls saying, I've called the sheriff's office, they said, I just want to make sure that we send a message as to who people need to get in touch with if something is not going.
Yes. So it is per this order, as with the other ones, this is enforced by state and local law enforcement officers. We do ask people, as you're reporting these to your local jurisdiction law enforcement, whether that's for a municipality or a county or city, to use a non-emergency line. But it should be to local law enforcement.
And we have not talked to the sheriff. Since this came out at 4 o'clock today, we have not really talked with the sheriff yet to see how he would implement. So I want to make sure we talk to him to see what manpower capacity he has before we give out a number, sir.
Okay, thank you.
So does the sheriff's department have to do this?
That would be a question for the sheriff.
That would be, wouldn't it? Yeah, okay.
We need to
All
talk
right.
to them first.
And that wasn't directed at you. That was kind of just came out for the board, but, okay.
All right, Fletcher, thank you so much. Any other questions, commissioners?
Let me make sure I understand something. Now, the restrictions will come off of the hotels when?
So that's, I jump in. So that's the question we're asking you tonight. It would be on Friday because our order does expire and it does link with the governor's orders. But that's the question for you guys to decide what you want our local order to look like. Staff recommendation is that it comes off, but that would be a decision for you guys to make.
So does it require a vote or guidance?
Let me comment. So with the really the 2 substantive areas where for this afternoon in the governor's announcement, the county had a different policy than the state. So we had we adopted this mask policy going into phase 2, and we before phase 2. It was just essential workers who were staying in hotels. We changed that, allowed 50% occupancy regardless of people's, occupation. And I'll just also kind of comment, because we were in a unique place on that as a policy-wise. I will remind folks, there were other counties in North Carolina who took even stronger positions than we ever did.
Oh, yeah.
Swain County said if you don't have a North Carolina license plate, not only can you not stay in a hotel, you cannot stop in our county. They had police officers out there saying, if it's not a North Carolina license plate, keep driving. So anyway, a lot of places wrestled with how to handle folks coming in from the outside. So we've had our policy, which was made more flexible. I was hoping to have some more discussion about it. I really appreciate the data the staff put together. I think that's helpful. I'm supportive of the recommendation. To me, I think they made sense at the time. We were entering phase 2, a lot of businesses reopening. I wanted to see how the data would come out once there's a lot more businesses reopening. Statewide, what we're hearing is that a lot of the trends are not going real well. 50% greater hospitalizations than 30 days ago. And if that trend continues for another month or 2, it's going to be, it's already a great concern, but it'll be a very significant challenge for the state if those trends don't level off and start going back down at some point soon. But I'm very heartened to hear that the rate of positive results for COVID testing in Buncombe County,
which is good, yeah.
Even as we moved into phase 2, has not grown. In fact, it sounds like it's gone down a little bit, even as the state's numbers. The states are around almost 10% now, right, or 9%. So that's very concerning for the state, but it's not what we're seeing locally. So it seems like we have some good data showing, even as restaurants have resumed activity, retail operations have resumed at a greater level. The community is continuing to do a good job in a lot of ways, preventing the community spread. So, with that data in hand, I'm comfortable with the staff's recommendation. It does, I think we will continue to see a gradual increase in folks visiting the area, which does bring some risk, but is also, so important to the, the fundamentals of the economy. So I'm supportive of the recommendation. And then with the governor's mask policy, that's the other area that we had differentiated. So if we're on the same page on lodging, and now the state has a mask policy, really the two pieces that we had left as a local policy seem like they're kind of being addressed. So anyway, those are my observations. Other comments or questions from commissioners?
Yes. Fletch and Dr. Mullendick, I got some questions here that's been come to me, and I'm giving to the county manager to give to you. Don't want answers to them today, but would like to have them everyone answered, within a week, 10 days. Give you time to look at them and everything, so she's got them. Other thing I want to make sure of is the hotel deal. I'm glad. I'm ready to open it up tonight, if we can, or Friday. I've talked to a lot of different hotels that are ready, got the staff to do it, but I have not talked to all of them, so I can't speak for all of them. But I guess the one thing I'm really got with my business is that I have several. The mask on here said we insist, right? Can we pull that slide back up? Okay, so, and I understand, okay, that the business will be, so I'll need signs to put in there, correct? Is that what I'm understanding? To put in my window or put on the business that you must, or we recommend the mask? That's not it, it's a signage that we was gonna have. Right there.
There it is. You must wear.
I think those are optional signs that you could use if you wanted to. Is that what you mean?
Them are optional signs. What I'm getting at is the bottom. You must wear a face covering in North Carolina or a face covering in Buncombe County.
Yes, sir.
My business has to have them on there, right?
You don't have to put one up, but that's required in North Carolina as of Friday. But you don't have to put a sign on your door or on your windows, but that will be the new law starting Friday in North Carolina.
I don't have, but if someone comes in not wearing a mask and we ask them, they are going to cite me. They're going to cite me. So I will need a sign to let them know. They can't read my mind. So, and not everyone. Someone out of state comes in from South Carolina. That's what. Yeah. Yep.
Thanks, Max. That's one of the reasons we're talking about the public awareness campaign, to make sure people are aware when you do come to North Carolina and Buncombe County or any other county in our state, right, as of Friday, a mask is required. Similar to when you go to Virginia and you see the signs that say talking on your cell phone is the law. That's what we're talking about, public awareness.
So I guess my question, going back, I've got to have the sign up because they've got to know, right? I don't think everybody's watching today. I don't think everybody watches TV. I don't think everybody's got internet.
But the governor made that the law starting Friday.
It's a law. And now getting to the part, I will have to enforce it. Correct?
As a business.
As a business.
As a business, your employees.
If they don't wear it coming in, how do I do that? Who do I call?
And that's what we were talking about. The business would have the option of how you provide service. You can say, I'll bring you your food outside versus you coming in. You can decide how you want to enforce that. But the governor answered the question today that if you must have your employees and your patrons wearing a mask in your business.
It looks to me like they're putting the law into the businesses out here to do this. I mean, you cannot ask 18 and 20-year-old kids, girls, to enforce something like this.
The other point the governor did make is if the patrons refuse, and you did cite that patron, that the patrons could be cited for trespassing. So if the sheriff or police were to come, you can get cited, but also the patrons could be cited for trespassing because they're not doing what you ask them to do.
Okay, but we have not talked to our local sheriff yet, have we, to see how he's going to do it, so.
I have not, so I can't answer yet how that will.
I would sure like to have this before Friday, where.
We would have that answer before that. We will talk to the sheriff. But I don't have an answer as I sit here tonight.
I don't know if he has.
So there's also, they're hard to read, but there's quite a few exclusions on, you know, that people, that we need to read, and we need, I mean, I can't read them, but I've seen a few of them, and I would assume that some of that impact has been softened based on, because I think of, I'm sure it's covered. If you got a autistic child that's 8 years old, that's near and dear to me, they're not going to wear a mask.
And that was our recapture.
So, but I'd say medical, whatever is on there, and that most reasonable people and businesses will work through that and not pick up the phone and call somebody. So, and you know, we just got to treat each other the way that we want to be treated when we go through this, because it's come out of the state, and we're going to have to deal with it. So, work through it.
Mr. Chairman, got
yes, sir.
A couple more things. Yeah. In our order, there are two items that we addressed earlier. Organized sporting activities in Buncombe County facilities are not permitted, and in food service establishments, not allowing self-serve. I know at the governor, they did allow people to start coming back for organized activities as long as they kept it under the 10. Is that something that we're still going to put in our?
We did amend that.
So that is
allowed in Buncombe County now.
So it is allowed, okay.
Yes, sir.
Okay.
Say that again, I'm sorry.
On the sports item.
On the sports, organized sports is allowed.
Okay, so organized sports will be allowed, but still the self-service is, we're still not allowing self-serve at the buffet line.
Yeah,
what I recall from that was the prior order did say self-service buffet was discouraged or should not be, but our environmental health staff wanted us to put a little bit more emphasis on it, and that's why it was included in our order. It's how I understand it. Now, again, we haven't had time to run this by our environmental health staff since the governor's newest order, but again, if he hasn't changed anything, so it should still be that self-service in buffet is not supposed to be done, if that was what I remember.
But that's according to?
That was the governor's order. I think we just added it into our order to make sure restaurants were aware, like to give a little bit more clarity of what does buffet and self-service mean. And
so when does the county, just refresh my memory, when does the county, we had a sunset date on the county's policy, right? It goes through Friday? What time on Friday?
5 o'clock.
5 o'clock. So ours sunsets on Friday at 5 o'clock. So if the county did nothing, basically it would sunset, and there would be the statewide policy, right? I'm not saying we don't do nothing. I'm just trying to understand the procedure here, but that's what would happen, right? Is that right?
The one thing I notice here that the board needs to be aware of is the section of new EO 147 where face coverings are required. For the state government, it indicates that members of the governor's cabinet shall wear face coverings, and it goes on to say that all other state and local government agencies are strongly encouraged to adopt similar policies that require face coverings. So if it's this board's will to have that face covering for local government, I mean, that's the only thing I see on my quick review that would need to be added in. We'd need to continue the March 12th order to create the EOC, as well as to adopt face coverings per authority of EO 147, and that'd be consistent with the retail establishments.
even though the state policy, I mean, it's in effect whether counties think it's brilliant or the worst idea ever, right? I mean, it's in effect, but it's just in terms of like sort of the message to the public of we're encouraging this, we're encouraging everyone to.
Well, I think that I just was trying to make the point that if the board determines to do nothing, then this kind of assembly would be exempt. And for services like in the tax office or any other government-facing office, forward-facing offices.
How would we be exempt? I thought the statewide policies were essentially kind of like a floor that everyone had to follow.
Well,
and if a community wanted to adopt something stronger, you could do that. But are you saying we're kind of exempted? The state
it's
can't
still
tell us what to do?
Government.
EO 141 is still in effect, and the universal, all the guidance I've heard regarding interpretation of EO 141 is that government operations have been exempt.
I see. Okay.
So that's why they put that, I think, as a clarification as to the authority of local governments in this new order.
Okay. Well, let me kind of summarize what I'm hearing. So is there any objection to supporting the staff's recommendation on the lodging policy, that we would basically have the same in the state? So there's not a local policy different from the state. People can stay in lodging. We could have this provision to make sure that that we are covered, right? And on the general mask policy, since there is now a statewide policy, there's essentially not a need for a local policy. In fact, the state policy in some ways is a little bit more stringent than the local policy. So basically, we would default to that state policy.
Right.
That's kind of my understanding of where this is going as of, Thursday, Friday. Ms. Pender?
So for that means that for our stay home, stay safe order, we would just align with the state.
Yeah, that's what I'm thinking.
But we are asking that we do still keep our state of emergency open, which is the EOC operation. So we still need something signed, is what I'm hearing you say.
Yes.
Yeah. But just for the EOC operations to have that piece, the state of emergency, but we would align fully with the state stay home, stay safe order.
Well, I'm supportive of that. I'll just kind of say, in principle, I think if we ever needed to have additional policies, I would support doing them. But I feel like with what the state's doing and where we're at right now, I'm supportive of that approach, at this time. Any other comments, commissioners, on this?
So the hotels would go into effect 5 o'clock? There's no way to do that. What's today? Sorry. Wednesday?
We can choose the time it goes into effect, right?
Why can we not, I would, the only thing, Chairman, that I would say is I would suggest that, as you say, we align with the state, with the exception of the EOC and the local government application, but that we, effective immediately upon this adoption or vote, that we allow the hotels to start booking. It gives them a day, it gives them a couple of days.
But they can start booking to go into effect immediately after
now.
Friday.
I mean,
is
now.
what I'm understanding. I hear what you're saying, Commissioner Belcher, but I just want to understand that we're not precluding them from taking reservations for full occupancy after Friday. Like, they can go ahead now and start taking those reservations. We're not precluding them.
I'm just saying that whatever occurs Friday at 5 o'clock, why not allow it now for the?
Mr. Cruz, do you have a comment? Okay, I thought you were raising your hand, sorry. Does our order need to go into effect at Friday at 5 p.m. or can we choose to make it go into effect whenever we decide to?
We could do it now, couldn't we?
That's what
I believe the board could do it now just to have it effective sooner than the states. We just have to craft it.
Okay. Well, yes, ma'am.
Similar to what you did with funerals, you can just make that effective immediately on the hotel piece because that already aligns with the state.
Yeah.
And then we can talk about the mask because the state doesn't kick in until Friday.
So do the staff need a little time to write this up?
Yes,
So,
sir.
so I think I'm not hearing any objection to what's going to go into effect. Could we have this written up so it can be signed and go into effect? And we can make it effective immediately when it's signed tomorrow. Does that work?
Yes.
Okay.
Or you can tonight, like we did with funerals, you can tonight at the podium say effective now. Hotels don't have that 50%. You can do that now,
Okay.
and then we can write it all up and have it effective
Okay.
as well.
All right, so I'll make a motion that we make the 50% policy, we'll go ahead and have that go out of effect now.
And the 24-hour waiting periods, that's the two things.
And the other
right?
related details around the
Yeah.
24-hour period, that's right.
Right.
Yes.
Second.
Further discussion? All in favor, please say aye.
Aye.
Any opposed? All right. And there'll be a few other items to work out, which
Correct.
we can do tomorrow.
Yes, sir.
Okay, all right.
Can we
Jasmine.
just clarify, we do plan to have the Buncombe County government adhere to this, correct?
Yes.
We plan to take the action to have the government do that?
Yeah, that was part of the.
Okay, great. I just wanted,
the
I heard a few different
EOC.
things. I want to
Yeah.
make sure that's where we were. Thank you.
All right. Commissioners, any other questions?
As a governmental entity, not just at the county level, right?
Could you clarify the question?
If I understood what you were lifting up, you were saying we would have to take an additional step so that the Buncombe County as an entity
Yes.
adhered to the policies, not just the policy of
That's us,
applying for
though.
Buncombe County, right?
Yes. Yes.
Okay, and we're going to do that.
And we're going to do that.
Okay, thank you very much.
Okay. All right, Dr. Mullendor, Fletcher, thank you so much for the updates. Thanks so much for your continuing great work in this area and for the great work of all the folks on your team. We appreciate it. That concludes all the items we have on our agenda. Is there a motion to adjourn? Oh, yeah. Do we had a closed session to discuss a few items before this meeting. Does the commission want to go back into closed session to discuss further? I think there was a few pieces of information we're still going to try to track down. So my recommendation would be to not go back into closed session tonight, but get that information and then resume soon. But it's up to the board. We could have a little bit of further dialogue this evening if people would like to do that.
I mean, it was on the, I would like to go back and let's take care of it, because our next
let's
meeting's not
close
until
it, yeah.
July the 21st.
Okay, that's fine. All right. Is there a motion to go back into closed session?
So move.
Second.
And that's pursuant to General Statute 143, 318, 11A6, a personnel matter.
And this is to discuss one personnel matter. Yes. All right. There's a motion and a second. All in favor, please say aye. Aye. Any opposed? We do not anticipate taking any action. When we come back out of the closed session, we will simply adjourn the meeting.